Researchers at the University of Louisville's Logistics and Distribution Institute are developing new cutting-edge technologies to help the world cope with the dramatic changes taking place in the industry.
Logistics and distribution is so fundamental. It doesn't matter what kind of business you're in. If you're shipping corn chips or steel belted radials, you still have to worry about getting the product there on time, undamaged, and get it unloaded from the truck in the proper fashion. And all these things they're able to model and to help businesses be more efficient.
We deploy probably in the neighborhood of 5 million units out of Louisville, so our distribution and logistics presence here is rather large. We use all three modes of transportation of rail, intermodal, and truck. We wanted a real robust model that would help us in how we select carriers based upon cost and distance. The advantage that the Institute brings to us is that they've been able to get deeply involved in our business and kind of understand what our key priorities and objectives are, how we operate, so that they could kind of tailor their solution set to what our specific needs are.
The private and public sectors can also benefit from what the Institute calls the LoDI Index.
The LoDI Index is designed to measure the health of the logistics and distribution industry by utilizing real-world transportation data along with regression analysis.
What we do is we look at the tonnage of cargo that is moved on 4 primary means of transportation: road, river, rail, and air. We look at all of the data and come up with an index that tells a business what they can expect for the next month in terms of logistics and distribution activity.
For the government, the biggest thing that they should be able to use this index for is to determine infrastructure planning. If the index shows that there's a large increase in transit, then they might want to consider, especially for the local area, when to build more bridges.
We are now in the process of developing a national level logistics and distribution index that's going to be a sort of thermometer for the logistics and distribution for the entire country.
What researchers at the LoDI Institute are most proud of is their work in the emergency services industry.
What we are doing is developing a real-time decision support system for use by healthcare and public health professional, as well as emergency service sector professional, for real-time decision making during a medical emergency.
During a pandemic or emergency of any type, it can be chaos. And trying to move supplies across the state, especially a state as wide as the state of Kentucky is, can be very difficult. The reason that we wrote the Strategic National Stockpile Distribution Program, the SNS program, was because we wanted to assist pandemic or emergency response personnel with distributing supplies across the state in the event that we have some sort of large-scale disaster. The way the system works is essentially we have a list that we've loaded into the system of all the warehouses, the distribution warehouses. And what we can do with the system is we can choose what portion of the state is actually affected. And from that list or that region, we can determine what the best way is to move the supplies from point A to point B.
Having these different applications saves time, it saves money, it saves man hours, but most importantly, it saves lives.
The EMS ambulance model helps dispatchers to make a better decision. This software collects and displays all the information about unserved patients and ambulances. The uniqueness of this software is the optimization tool. We use that. This optimization tool can give the best route and to the ambulance to go to the closest hospital, and also with this tool, the ambulance can have the option to go to pick up another patient, more than one patient, or even this ambulance can reroute.
The Institute already has proven success in the healthcare industry.
A few years ago, the county health agency came to us and said, we need to distribute several thousand doses of the influenza vaccine. How can we do this? And so the people in LoDI were able to draw up mathematical models, do computer modeling to show how many nurses do you have to have, how many lanes do you have to have at the football stadium so people can drive up and get their immunizations.
I can't say enough about the Logistics and Distribution Institute. They're really taking some concepts of emergency disaster and pushing the bounds of what's possible.